Hello everyone. So today we'll be studying vitamin A. Vitamin A is a fat-soluble vitamin that includes retinol, and retinoic acid. First, we'll discuss the uses. Then we'll see what happens in the vitamin A deficiency. Then we'll see what happens if you take excess of vitamin A and the tests for vitamin A deficiency. So uses. The uses of vitamin A is basically vitamin A is found in the visual pigments that is used for dark vision. That is why it is used for night vision. It prevents squamous metaplasia because it helps in normal differentiation of epithelial cells into specialized tissue, and thus it prevents squamous metaplasia. So what happens in vitamin A deficiency? So basically the symptoms of vitamin A deficiency includes night blindness. That is usually the first symptom. It may be symptomless, means night blindness may usually go unnoticed if the patient is not aware of, it's if the patient is not quite then he may not notice it. So nyctoblopia is the first symptom. Then decreased immunity or increased susceptibility to infections. Then maybe metaplasia. Then maybe corneal cirrhosis, conjunctival squamous metaplasia, that is bitter spot. Then there may be dry eyes or xerophthalmia and corneal degeneration, that is keratomalacia. Okay, so these are the symptoms of vitamin A deficiency. Okay, nyctalopia, decreased immunity, then corneal xerosis, then conjunctival squamous metaplasia, that is bitter spot, then dry eyes, there is xerophthalmia, and corneal degeneration, that is keratomalacia. Okay, now what are the tests of vitamin A deficiency? The tests of vitamin A deficiency are dark adaptation time and serum vitamin A Carr and Price reaction. Okay, serum vitamin A. Okay, so that is the tests used for vitamin A deficiency. Now what happens if there is excess of vitamin A? So symptoms of excess of vitamin A can be divided into acute toxicity and chronic toxicity. Acute toxicity is basically when in acute toxicity there would be raised intracranial pressure, that is pseudo tumor cerebri, where there would be vertigo, blurred vision, nausea and vomiting. Okay, in chronic toxicity there would be alopecia, dry skin, hepatotoxicity and raised intracranial pressure. Okay, now very important one point that you have to remember is vitamin A is teratogenic. Okay, vitamin A is teratogenic and you should never give it to a pregnant lady. Okay, never give it to pregnant lady. Okay, because it may cause cleft palate, cardiac abnormalities, okay, and therefore you have to get a pregnancy test done before prescribing vitamin A. Okay, now vitamin A is used for acne. So what type of vitamin A? Isotretinoin is used for acne. Okay, and all trans retinoic acid is used to treat leukemia.